When I go into an office for a day of consultation, I always start by asking for a printout of a day sheet from each hygiene provider. I give them a few random days so they don't pick the best or the worst days. I want to see just typical days. These day sheets will show me what procedures the hygienist is most comfortable in providing. 99% of the time, the day sheets will be about half a sheet long and have about 8, 11, 10 codes and a few bite wing codes. In other words, the hygiene department is a prophy mill, and the hygienist needs some help with their verbal skills to present things that aren't covered by insurance. The good news is I can help you with that. Remember, we are serving individuals with individual needs. Not only that, we have several services beyond Prophies that help prevent dental disease. Those day sheets should reflect all that we can offer. There should be codes listed for some fluoride treatments, sealants, full mouth series of x-rays, panos, oral cancer screenings, desensitizing agents, whitening trays, and night guards. Not to mention periodontal therapy. Currently, the CDC reports that 47% aged 30 years and older have some form of periodontal disease. It also increases with age because 70% of adults 65 years and older have periodontal disease. It is more common in men than women, and 65% of those living below the federal poverty level have it. 66% of those with less than a high school education have it, and 64% of current smokers have it. So when I see 99% of the day sheets I pull have just prophy codes, just doesn't make sense. So be sure and watch my soft tissue management classes to help you increase that. Let's talk about fluoride and sealants. In Dental Economics, August 2008, Gordon Christensen said many researchers and organizations are recommending fluoride varnishes on both children and adults, applied during a routine regular recall appointment. Also, the ADA and the American Academy of Pediatric Dentistry recommends the use of pit and fissure sealants on occlusal surfaces of primary and permanent molars in children and adolescents. So then I look at the patient age demographics of the practice and the patient base to see if there's any more opportunities to do more sealants. During my consultation with the dental team, I asked them also if they have a radiographic protocol set up. The dentist says, yeah, sure we do. And everyone else is kind of like, do we? Yeah, kind of, I think so. I give tips on how to increase case acceptance with all these services so that you can serve your patient's individual needs and increase the level of care and profitability to the hygiene department. Now let's talk about oral cancer. If you do screenings for free, why isn't it on the day sheet? These codes should be on the patient's receipt or at least the EOB so that the patient knows that their appointment is more than just a cleaning. In JADA, March 2013, an article concluded that 1 in 8 participants from general practices had dentin hypersensitivity. When I don't see any night guards or desensitizing agents done in a month's time period, I see a fantastic opportunity to improve the quality of life for patients. Impressions or a scan of a patient's mouth is easy to do for a night guard or whitening trays. Patients love whitening trays. We have all had those patients with gum disease and broken teeth who say, can I get a quote on how much whitening would cost? I really want my teeth whitened. But in all seriousness, many dental offices don't offer whitening enough either. We all have a responsibility and a liability to recommend what's best for our patients' individual needs, not only what is allowed by insurance. You are allowed and expected to present what you think could benefit the patient's oral health. The patient is allowed to decline, but make sure you don't let the patient dictate what you present. And then if they're interested, for heaven's sakes, help them find a way to pay for it. Now, not every patient needs all of these services. You need to do a thorough exam to find out what the patient wants. In addition to their wants, I recommend a caries assessment on each patient. You can download a free pamphlet that I used in my practices and then have the patient self-discover if they are low, medium, or high risk. They will become more interested in prevention. And you will be amazed how many people are high risk, me included. I have a great home care routine, but I have an awful love for diet soda. So I get my fluoride varnish treatment every time I get a cleaning. So help your patients help themselves by implementing a caries risk assessment so that they can take control of the services they could benefit from. An old Chinese proverb says, inferior doctors treat disease, mediocre doctors treat impending disease, and superior doctors prevent disease. I love helping hygiene departments become superior. So join me in my next video for the tools to increase case acceptance in procedures other than just Prophies, and find out how I increased several practices' hygiene production by $200,000 in less than a year. I hope you open your minds and invest in prevention, like so many of my clients have. That's it, guys. If you have any questions, shoot me an email.